Okay, so this time we're going to practice doing the primary setup of something liquid. Okay, usually the tubes that they come down in are plastic. So I've already labeled my plate. I've already labeled my 2 slides. Now what I'm going to do is I'm going to take my transfer pipette, disposable transfer pipette. I'm going to take the top in my little pinky and hold it there. Without touching the sides, I'm going to go into the specimen, pull out a little bit of the specimen, put it onto the plate. 1 drop is good. Put the rest of it back into the tube and throw the transfer pipette away. Going to leave the plate right side up so that it doesn't get lost onto the top of the plate. Then I'm going to put the top back on the tube, and since it's a regular specimen, you don't need to worry about turning it back. If this was something that you were growing, you would do a half a turn back to make sure there's air in there. Oops, also forgot to do the 2 slides. So going back in, 1 drop on each. Okay. I want to conserve the specimen. Okay, I am growing something in there, so I turned it back. All right, so now for inoculation. So we're gonna do wherever the drop was, that's gonna be your first quadrant. Then we're gonna go in twice, pull out for the second, go in twice, pull out for the third, go in once, and that's your 4 quadrant plate. And then you're going to move the specimen around on the slides. Try not to get it on the edge like I did on this one. Again, you're trying to control possibility of infectious disease among your coworkers. And then we would go put it on a drying block, the heat block. So let's go do that, and then we would gram stain them. Okay, so here we go. Woo! Okay, notice the blood culture ones look dry now. Notice they look, it's a solid sheen there, so they're ready to be gram stained.